right, since President Obama's health care reform was signed into law, I don't know if you heard about that, the administration has approved 1,372 waivers. And and hundreds of those companies are union companies.
That's right. And unions themselves. The waivers allow those companies and unions to skip over the mandated plan. And some say that's just proof that the new law is not a good one. Joining us right now is Wyoming Republican Senator John Barrasso, who's also an orthopedic surgeon, and we'll talk about my aching foot during the commercial.
Happy to do it.
Okay. So we were sold. This plan's going to change everything. It's going to be great. Fast forward to today, you got over 1,000 companies and unions, big unions, saying, we can't afford it. We need a little pass, a waiver.
And it's for 3 million people. About 1.5 million of them are union workers. These are the unions that supported the health care law, lobbied for it, said to President Obama, this is what we want. Now when they've read it, remember Nancy Pelosi said first you have to read it before you get to, first we have to pass it before you get to find out what's in it. Now they're saying, no, we don't want this. And again, this past week, they've come out with a whole nother list. More unions, more waivers.
Now, let me ask you something. From the union perspective, what do they find so egregious and unpalatable about this?
Well, it's the amount of coverage that Obamacare mandates, 750,000 of coverage. And a lot of these plans say, that's too expensive. We can't afford to provide that kind of insurance. They said, so let us out, give us a waiver, don't make it apply to us. But it does apply to so many of the other businesses around the country.
For a year, right? Is this waiver just for a year?
They'll need it for 4 years, but they only give them a 1-year waiver saying, now don't say anything because you're going to have to come back again next year if you want another waiver, so you better be nice to us and don't talk badly about the health care law.
Now, let me get this straight. So if they only get a waiver for 1 year, but they need it for 4 years, those are some of the companies and unions that have asked for, and those are big
Regis and Kelly, a bit of a surprise.
Look at that. McDonald's, Dish, you've got Waffle House, Jack in the Box, Denny's. These are big companies.
Well, and yesterday's list that came out, the Service Employees International Union, AFL, CIO, all of the big unions.
Right, and that's very impressive because when you think those are the people who are in the president's corner, they're trying to support him, and yet they've got to admit, we can't afford it right now.
Yeah, you know, I think every American ought to have a waiver. I think we ought to repeal and replace this health care law, but I don't want to stop at 3 million. I want everybody to have a waiver, not just friends in high places, people that can get to the Secretary of Health and Human Services.
Senator, it's great to have you. I know you're an orthopedic surgeon. Could you write a prescription for some allergy medicine? We're all suffering.
Well, I'd be happy, but yeah, we were at the White House with the president on Thursday, and I told him what I'll tell you now. 25 years practice in medicine, taking care of a lot of people with Medicare and Medicaid. I have to tell you, his payment advisory board, it is going to, he wants to cut another $1.5 trillion from our seniors on Medicare. It is going to make it even that much more difficult for seniors to get care under the president's health care law.
Senator John Barrasso.
Thank you very much. Thanks for having me.
Right. Senator, I'll shake your hand on the break. We just got to go.